Because of COVID-19, a lot of organizations had to jump into providing services remotely. They had to quickly pivot and identify a video conferencing system that they could use to meet with their clients and patients remotely. However, now that things have taken place for a while, they can take a breath and reevaluate. So to discuss this, we have Jay Ostrowski and Sanella Malako with Adaptive Telehealth. And in the consultation services that we provide for organizations, we hear from a lot of organizations things that they're struggling with. One of the first things we do when providing a consultation is to look at the organization's workflow. From how is it that clients or patients schedule an appointment? How does documentation happen? How do they get the link to the video meeting? How do you communicate with them? How does billing happen? All those kind of pieces of the puzzle. And we find that a lot of the things that they struggle are getting electronic signatures rather than having to rely on those verbal consents, and communicating with their patients and clients securely. Clients and patients, they love secure messaging or chat or text, those kind of methods. And often clinicians or staff within an organization are doing those things in an unsecure way because they don't have a secure platform for that. Another thing that they're struggling with is the quality of the video conferencing platform. People getting kicked out of the meeting because they don't have inadequate bandwidth for that system, or the system just isn't really working well for them. And then the time that it takes to get the client or patient on the video conferencing platform and helping them with the tech issues is a big concern. Another thing is evaluating the telehealth services. So now that organizations have been providing telehealth for a while, they want to step back and evaluate, how is this working for the end users, right? For the client and the patient, and also the clinicians, because we want everyone to be satisfied so they come back. So they also find that a lot of the platforms that they're already currently using are inadequate. And because of that, they recognize that they want a platform where they can scale and they could add on services as needed. So we have found that Adaptive Telehealth provides a lot of customization. It's a very robust program where you could add functionality as needed, but also it's applicable for very large organizations to a very small private practice. So Jay and Sanella, thank you very much for joining us, because I know people are going to really want to get a sneak peek view at Adaptive Telehealth and how you guys have done this.
Thanks, Ray. And Ray and I go back many years studying telehealth together, and back to the board certification origins. And I'm excited about that. I saw my first client many years ago, and out of that frustration, like 10, 15 years ago, actually. And over the years practicing telehealth, we made this platform because of these frustrations that we couldn't find other platforms would do. And as we work with every different client, we find different needs. So we made an adaptive platform that we could adjust to the various needs. And so, to our knowledge, we're the most adjustable of all the platforms on the planet. But we want to show you a couple of those instances so you can see what that's like. So on the screen now, you see a provider login. This is call it a provider because you can change the names to show different roles. So maybe you call it doctor or counselor or psychiatrist, whatever. We have actually 11 roles within Adaptive Telehealth. What you're looking at here is the provider's dashboard. It's a demonstration. None of this is real data. It's all fake data. And we have turned on a lot of different things here. So you probably would have a lot less on your screen, depending on what you want the functionalities. A lot of people have their own EMR, their own other systems. So maybe they don't want our billing, they don't want our scheduling, or maybe they do and they want it to integrate with their current systems. We do that kind of work. So on the screen, I just wanted to just quickly highlight when there's an appointment made through video, it's all automated. You don't have to share any links or anything like that. If your client is on the platform, it's easy invitation. the link just shows up here for them. So they just log in and click it, and you can see it has all the data that you would need for the appointment. You can even edit it or add people to it if you want. It can also be used for in-person and online. So below you have your client list of all your clients, and you can change the order of how you want things seen on the screen. In case you want a different view of the data, your custom data can be on here. We even have it in Spanish if you wanted Spanish version. So these are the client profiles. So everything, all these side menus here, all the data in here is also going to be in your client file. So if you message a client, it's also the messages in your client file. If you share a document, it's also automatically filed in the right places. So you don't have to do a lot of that extra work. But it's simple to come in and create the schedule for the client. For yourself, you can have automated scheduling where the client picks from openings, and you can tag these openings to be to be your workflows. So being seen or rescheduled or canceled or seen depends on what you want. The schedule appointments could be in person or video, and you can add any clients you want, even other providers if you have other clinicians in your practice that you want to do that with. So quite a versatile platform. You can have recurring meetings, have reminders, text reminders, or even email reminders, different list views, lots of different things on here. One of my favorites though is checking the video and the audio before a session, so you can have these automatically checked to make sure that all of this is done for you before you even have a session, so you can have the video. So we've built in a lot of these features up front so that you can have a lot of automation in your practice. Ray, did you have a couple things to point out?
Yeah. So you can see here how adaptive telehealth solves a lot of these problems. So there's a wonderful client portal that looks very similar to this. So the client gets access to the clinician to message them, meet with them through video, sign off on their consent forms, see their invoices, pay their bills. So that's very helpful. In terms of the video conferencing issues that a lot of organizations are having, adaptive telehealth uses Zoom, and which, as of now, I believe has the highest quality video. People don't seem to have issues using Zoom. It's also widely used, so people are very used to it. A lot of clients and patients are already using Zoom for work and for school, so they're already very familiar with it. And the process that adaptive telehealth goes through to prepare the client automatically, automated through the system for that video session really overcomes a lot of those challenges. Another thing that you'll find beneficial is a lot of organizations using EHRs now that allow for interoperability are looking to partner with other organizations to send and receive referrals. And they want to do that right through the EHRs, where they can send and receive referrals directly through their systems, rather than having separate ways for every organization that they're going to partner with. So we find that very helpful. Just to give you some other situations that adaptive telehealth has helped a lot of those that we work with is parental consents, right? So a lot of times you want a parental consent that's separate from the child's consent. A lot of times you want different users in groups. So you could have a supervisor, clinical supervisor, an admin person. You can have collaterals in the system that work with the patient or client. And then in terms of groups, it's so hard to find a platform that works well for groups. So if you have groups of people that you want to receive services together, either through video sessions or a chat forum for that specific group, this allows for it. In terms of getting feedback about your telehealth services so that you can continually improve it for your clients and patients and your clinicians, providing surveys to get that data is very helpful. So with adaptive telehealth, you can use their survey builder or form builder to build the surveys and evaluations that you want. Not only that, they have a report builder, so that you'll be able to get reporting on the results of those surveys, so you'll be able to do some analysis and improvements. So I have found adaptive telehealth to be really helpful for a lot of the organizations that we work with. So thank you, Jay and Sanella, for providing this and maintaining it. And going back to the beginning, right, where Jay was talking about why he created this in the first place, one thing that's important to me is that adaptive telehealth is founded and owned and maintained and improved by a clinician, right, Jay Ostrowski, who is a mental health clinician and an expert in HIPAA compliance. So having that basis of watching out for privacy and security and what the needs truly are for clinicians is very important. Is there anything else you'd like to mention?
We could mention quite a lot, actually. So I guess I would recommend people contacting Ray, and he'll connect you with us, and we can talk about whatever your needs are. I think we have over 90 features actually in a HIPAA compliant environment that could be deployed to meet really unique use cases at a very low cost. Thanks for having us.
Thank you.